Just a moment. Yeah, everyone coming in. Okay, so Ellen has been an undergraduate teacher for acupuncture course 26 years ago. And since then, he has been hosting postgraduate students in his clinics worldwide, in Europe, Indonesia, and in North and South America. Today, we'll have Naomi Jansson, his daughter. She's a second-generation acupuncturist, and they run a clinic together in the Gold Coast. And she's also a student of traditional Japanese acupuncture, and she will be doing the recording, and she will be helping with the organization of the treatment. The purpose of these webinars is mainly for traditional Chinese practitioners that want to make the bridge to the understanding of traditional Japanese acupuncture. So I will ask everyone to mute their sound. You can leave your video on, and please make your questions at the end of the talk through the chat. So I will pass it on to Ellen and Naomi. Thank you.
All righty, let's go. So constitutionally, when I initially started to treat Vivian, she presented as what we call a liver deficiency, yang deficiency constitution, which in the TCM sense is blood deficiency. So both the Jin Yang and the Qi of the liver are deficient. The last two treatments, however, as a result of the Rona and the lockdown and the minimal activity, it seemed as though Vivian's condition was improving. I say that because she came into this world as what we call the liver deficiency, yin deficiency constitution. She is a perfectionist, and she will keep going until she has achieved her goal. And the consequence of that, particularly if you combine it with her career, which was an airline hostess with rugged hours, and her tenacity to continue to go until it's absolutely spot on. This is the tendency of the liver deficiency, yin deficiency constitution. But the consequence of that, especially when it's very intense and it's pushing all the time, combine that with the effect of a lot of air travel, and there's potentially a possibility of the patient tipping over. So not just the Jin Yang of the liver is deficient, but the Yang Qi or the Qi of the blood also becomes deficient. So you've both got a lack of fluid or quantity, and also a lack of quality because the Yang Qi diminishes as well. So what this means that there any sort of symptomology can come up depending on the particular tendency of the patient. In Vivian's case, she suffered from migraine headaches for how long, Dali? 30 years of migraine headaches. When Vivian's, normally when she's undertaking a course of treatment, we can usually bring the migraines under control, and she can go about her daily life without any severe consequences. And the migraines she does get, when she gets them, are pretty heavy, and really knock her out of the game for a day or two. So constitutionally, she's predisposed towards the migraines. The reason is her constitution, which is liver yin deficiency, but she's moved into yang deficiency, which is not just a deficiency of the Jin Yang, but also a deficiency of the Qi or the Qi as well. And I'll let you take the story from here, please.
Yeah, I just let Alan know this morning that yesterday I woke up with a migraine, and so my last resort is a migraine tablet, which I did end up taking and didn't work. So then an hour later I had to take another one, which still didn't work. But ice packs and sleep. But like Alan said, it knocks me around for the rest of the day. I become quite slow. So I'm still a little bit achy today in the head, but nothing I can not go throughout the day with, but it's perfect timing today to be here.
So if Vivian were a new patient, then I would know fairly quickly, and there would be a tendency, because the stature, she's in very good shape physically. She's practiced yoga. She practiced hot yoga for some time, much to my yeah, I wasn't real happy about it, but hey, you've got to let the patient do what they want to do. But from my perspective, practicing the hot yoga would smash the yin yang even more. And basically that, and having 2 children as well. Both, how old's Barley now? 10?
She's 14, yeah. And the hot yoga was for about 6 years solid.
6 years solid, yeah. So we had Vivian at one stage 100%, and she would be able to get a migraine. At the moment, she's getting a few more coming in. Last 2 weeks, I've treated Vivian as what we call liver deficiency yin deficiency syndrome. That is where the yin yang is deficient. However, upon taking her pulse this morning, I'm querulous. I'm thinking that perhaps Vivian has dropped back into liver deficiency, yang deficiency syndrome. So if Vivian were a new patient, she would have filled out a patient record form noting all the idiosyncrasies of her health, how she sleeps, does she suffer from headaches, where are the headaches, is her digestive system working well, the respiratory system working well, what other factors are happening in her life. She's been under stress, and we have a patient record sheet where people actually let us know. So when the patient comes up, I already have an idea of what's going on. So I can really refine my questioning from my perspective to get a patient that's had a migraine yesterday, and they're a new patient, they come in and I spend half an hour questioning them, can be very exhausting. I much prefer to have an idea and be very specific in my questions so that I can delineate what I'm going to do in the treatment and also get some understanding of the patient's constitution. You'll notice with Vivian's eyes, she very much has a very almond-shaped eyes. So these are characteristics of the liver yin deficiency person, perfectionist. But today, we'll do a little bit of work with the Hara. You'll notice I'm rubbing my hands together. I'm trying to get a little bit of warmth. We're just heading into winter here. So we'll just expose Vivian's tummy. And we'll put some, excuse me, my hands are a little cool. So I'm going to be just introduce myself to Vivian's tummy, which is nice and warm, unlike my hands. And you can see here that my entire hand is actually on Vivian's tummy, and I'm just palpating the right side of the abdomen here. Vivian's probably not expressing or feeling much discomfort there. So we'll come up, we'll check just in the hypochondria area. Liver feels good, there's no inflammation, there's no hardness, swelling or heat there. Or a little bit discomfort here. Yeah, not so much. Then we come over to the left-hand side of the abdomen, and Vivian starts to experience a little bit of discomfort there. And there and okay. So when we have the pattern where the discomfort is running down the left-hand side of the abdomen, we could say comfortably that there is a propensity to liver deficiency constitution. Also, just to make note, in this line down here, this is the kidney meridian here, and Vivian, because she's had 2 children, she's in incredibly good shape, but her tummy is not as firm as it would have been pre-children. But also, when I come in here, just to lateral to the midline here, lateral to the conception vessel, I can feel a tight band, especially on the right side here. This usually indicates some degree of kidney deficiency. So to be liver deficient, we inherently must also be kidney deficient, because it's the kidney, the water element, that supports the liver by supplying the liver with yin yang, the fluids. Yeah? And then over a period of time, if the yin yang has been deficient over an extended period of time, then the yang qi can also become diminished. I'm just checking. See. We just check. Yeah, there's quite a bit of heat through the chest and the neck. So the general idea is not so much cold down here, but it's more softness compared to the upper part of Vivian's body. So I'm now going to take Vivian's pulse. And I'm feeling a very sunken, very thin pulse. What happens now when we just do a little bit of work through here to encourage the liver a little. Now, if this is Vivian's condition is a yin deficiency, then I would expect the pulse to be a lot more prominent, especially the gallbladder, even after that little bit of work there.
What needle technique were you using there?
Contact needling.
Contact needling.
So there's a little bit extra in the gallbladder, but definitely I'm underwhelmed by both liver and gallbladder pulse. The liver pulse is deficient and sunken, and the gallbladder pulse is very thin. I wouldn't even call it tight. It's almost non-existent. So the phenomena there is that with the yang deficiency, there can be cold in the lower jiao and cold in the middle jiao, and the heat can get caught in the upper jiao. This is one of the phenomena that can happen. So the irony of that is someone that's liver yang deficiency or blood deficient is totally exhausted, but they can't sleep. And they can't sleep because the predominant amount of the yang qi is up in the upper jiao area here. So the reason they're unable to sleep is that the yang qi is not actually moving down through the middle and lower jiao, and they feel tired and exhausted because there's not enough yang qi moving out to the limbs, particularly to the legs. So our goal when we're treating what we call liver deficiency, yang deficiency, cold syndrome, is to warm the middle and lower jiao and invigorate the movement of yang qi so that it doesn't get caught in the upper heater. It actually is enough strength in the yang qi to move down through the middle and lower heaters and then just get the circulation moving right through again. Okay? So I'm preparing the point here. You can see I'm moving the defensive key away so that when I place the shinkan, and I'm just tap, tap, tap. So that's it. For those of you that practice TCM, you may look at what I'm doing now and be in an absolute state of disbelief that this could do anything. I was in the same position when I first saw this. I could not comprehend that that this would actually do something. The first person I saw doing this technique was Edward Obeidi Sensei. So I'm using Tai Chi, kidney 3, again the same technique, moving, opening the point up, using this index finger. Then we come in and I spread. Some people will clench the skin together. You see, very light tapping but repeated. So you're going in slowly and very gently to make the treatment as painless as possible. I have the key moving down the lung meridian, and this is the metal element here, the large intestine meridian and the lung meridian. No accident that this, the Oshidi, encompasses the metal element. Okay.
Excuse me, Alan Sensei, just how deep are you inserting that needle?
In this case, 1 millimeter, 2 at the maximum. And you'll notice that I'm closing the point after I take the needle out. So I'm going in slowly, then I come out quickly and close the point. You can refer to the Ling Shu, that tells you how to do that. So this is not it's not specifically a Japanese technique. This is actually a technique that's mentioned in the Ling Shu, which you should know is an ancient Chinese classic. So again, you'll notice that it's just tap, 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 and I use this part of the finger just to come in because I've got the big fingers, and if I try and do it from the end of the finger and bang, 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 I don't have anywhere near as much as control as I'm using my finger like so, yeah? I am focusing on my breathing and doing my best to not focus so much on what I'm saying. Again, close the point. Coming over, opening the point up again, and we open it through here, and tap, 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 tap. My focus is on the tip of the needle. As human beings, particularly Caucasians, lung deficient constitution, of which Vivian is to some degree, as well as being primarily liver deficient, we're extremely sensitive. Our chi moves a lot closer to the surface. That's why we have hair on our bodies to keep the heat in. This is spleen 1, very important to needle painlessly. Again, brush it. This is the wood point. When we tonify it, it has the function of gathering. When we disperse it, it has the function of really strongly dispersing. So it's imperative that when we're using the wood points, if we want to tonify, it must be painless. So this is just a little more than contact. It's just slight penetration. And that's spleen 1. So that's the fundamental root treatment for liver deficiency, yang deficiency. I will be adding one more point to the treatment to stimulate the movement of the yang qi from the head through the gallbladder meridian. So we've tonified the yang of the kidney, tonified the yang of the liver. That also involves the yin qi, but primarily we're tonifying utilising the nutritive qi in those meridians while you're working with the yuan source points. Splitting 1 is the wood point, so we just, what we're doing is we're consolidating because we've actually used some of the energy from the spleen meridian by using the birth points of the kidney and liver. So we're going to take a little bit back and put it back in the spleen. And it also helps to stimulate the movement of the yang qi through the tai yin meridian. And then to finish the treatment off, or the root treatment off, I'm going to tonify gallbladder 41, Lin Che. This is to stimulate the movement of yang qi from the head back down to the feet. Seal the point again. I'm tonifying here. I'm not shunting, I'm not dispersing. I'm actually encouraging the yang qi to move down. And notice that my Oshid is nowhere near as good as Ikeda Sensei's, but it seems to work okay for me. Alrighty, so I'm just going to check Viv's pulse again now. The fact that Viv woke up with a headache also is indicative of liver deficiency. If the patient wakes up exhausted or super tired or with a headache, it means the yang qi has been caught in the upper jiao throughout the night. So the liver hasn't been able to bring all the yang qi back in. And there's more of a gallbladder pulse. I'm certainly not jumping up and down and saying, Viv, go out and run a marathon, but I'm hoping that by the end of the treatment, Vivian's feeling a lot stronger. So when I'm taking the pulse again, just to reiterate, I'm using the pads of the fingers to take the pulse, not the tips, the pads. Coming in, and I'm now looking at the balance. Okay, is there any heat in the lung meridian? Checking it out. Just open up a little bit more. No, it's okay. No, all good there. Spleen is thin again, but the pulse is present. So for okay, that is the root treatment. I'm going to demonstrate the rest of the treatment as well. This is something we'll go into a bit later on after we've done a little bit of work with constitutions, we might talk about the application of the back tube points and front loop points. They're very important also. From a classical perspective, from the Ling Shu, absolutely, the Ling Shu is adamant that this part of the treatment, what we call the root treatment, is this is where it happens. This is the action. This is the turbocharger. We get this right, then the outcome of the treatment invariably will be positive. If we get the local treatment correct as well, then we get an ultra-positive outcome, which is what we're aiming for today. So you'll notice in the first part of the treatment, I use the metal shinkan because the fact that the command points when we do the root treatment, it is so important. We can put everything into that, and the rest is like we're just jumping on board the train that's already moving. So the root treatment is the prime mover and motivator of the treatment. So I'm using the metal shinkan when I do the root treatment. Again, the metal is a conductor of yang qi, or warmth or heat. Likewise, the metal needles and the stainless steel needles are good conductor of heat. I did try for some time the Siren needles with the plastic handles, but I just didn't feel the same with the plastic handle, being that plastic is an insulator. And we're talking about human-to-human medicine. We're talking about a very subtle form of energetic exchange. And it is very tough if we've grown up in a school and thought that we have to get Da Qi and really strong needle stimulation to achieve a positive clinical outcome. It's a very difficult step to make. Think, oh, no, maybe not, maybe not. My experience, I stopped needling for 3 years to just to try and understand how it worked. And I found that my results were still pretty good. But once I married the applicable techniques, so sometimes deeper needling in different areas locally, but with the root treatment, it's invariably superficial needling, no very deep areas, no half a cell, 1.5 cell, none of that business. And I found, hey, hang on, this really works, and oh, the patients really like it, and they don't suffer from pain, and they get up with a big smile on their face. So it's very, very important from my perspective to, in regard of being able to provide a really relaxing and energising treatment for the patient, and to do that with minimal discomfort. And that way it will encourage the patient to come back on a more regular basis, and in some cases, preventative medicine, which is the bottom line. We understand the constitutions, we're able to apply the root treatment, and we're looking at our patients from a classical perspective, then we will be able to provide them with a true preventative medicine treatment, not just a stab in the dark, like we use this 6 points for everyone's immune system's going to get better. Yeah, maybe there's some benefit in that, sure. But if we're able to understand the constitution of the patient and apply the treatments as such, then we have a very, very strong chance of helping that patient maintain their best health that they can at any given time. So, Mika Sensei rarely puts these first set of points in, but I find they do help me, particularly in the case of situations like the migraine headache. So we'll start with a gallbladder 12. And again, you'll see that I've just needled it very superficially. And then because the needles are supplied with a plastic tube, I'm now able to swing over to the plastic tube. And again, but in this situation, particularly with Vivian's constitution, with the pulse being really sunken and her being a bit exhausted and tired after her experience yesterday, I want to be as gentle as I possibly can. So here you see me, these are the gallbladder points here. I've used gallbladder 21, gallbladder 12 and 20. I've used bladder 14, bladder 18 again. You'll see I'm preparing the points. I'm opening them up. So I'm spreading the yang qi, the defensive energy. You'll notice that the needles are laying down on the skin. Again, there are so many benefits to this superficial needling of the Tai Yang meridian. I'll talk about that in a moment. Get down here to bladder 23. I'm also going to encourage the movement of the yang qi down, so I'm using gallbladder 30. And then I'm going to finish off with bladder 58, which is the low point of the bladder meridian and as such connects to the kidney meridian. The theory being is that we're stimulating the movement of the yang qi in the Tai Yang meridian. So if we use the low point at the bottom end of the bladder meridian, it would only make common sense if we would utilise the traditional principles that any excess yang qi will move around to the kidney. And you'll notice now that I'm covering Vivian up totally. So we're summoning the yang qi to the surface of the body. So if we leave the patient uncovered, then not only do they have to, are they being encouraged, the qi being encouraged to move, the qi also has to work to maintain warmth of the body. So the outcome of the treatment can be effective if the patient is cold. When we're looking at all these little particular aspects of treatment to gradually get the efficacy to a higher, more evolved level. If we apply traditional East Asian medicine as espoused in the ancient Chinese classics, if we are to recognise that the bladder meridian is Tai Yang, so Tai Yang, as you know, is the most superficial. So I'm going to leave Vivian now here to relax for a few minutes.
There was, while you were treating, because with the sound sometimes we couldn't hear very well, what were exactly the points you used, just to make a review of the points? So what points you used for root treatment and then the back shoe points, please?
Okay, I used the Yuan source point of kidney meridian, kidney 3. I used the Yuan source point of liver meridian, liver 3. I used gallbladder 41 on the yang meridian, the Shao Yang meridian, and spleen 1 on Tai Yin. Bladder 14, which is the back shoot point for pericardium, as you will probably know. Bladder 18, back shoot point for the liver. Bladder 20, back shoot point for the spleen. Bladder 23, back shoot point for the kidney. And bladder 58, the low point on the bladder meridian to help recycle the yang qi that's flowing in the Tai Yang meridian back into the kidney. I did wax on lyrical about the benefit of needling superficially on the Tai Yang meridian, amongst other things, the fact that we can insulate the patient and keep them warm, very, very important factor. There are several different ways of needling the back shoot points. We will finish the treatment off in about 7 or 8 minutes because we don't want to overtreat, because in this situation, the patient is yang deficient. So it's a bit like if we've got a small battery and we try and get to start it and use too much of the battery will go flat. So the battery at the moment, Vivian's battery, the charge in it is very, very low. So our stimulation is very, very measured, very gentle and very subtle. That way we can utilize the resource to build up that energetic presence in the liver kidney meridians. If we go in too hard and we push the qi around, then there's not enough qi and blood to respond, so we will flatten the battery rather than charge it. And the gallbladder points, gallbladder 12, gallbladder 20 and 21.
Can I ask a question? Can I ask a little bit about the theoretical underpinning of your point choices for Vivian's treatment?
The Yuan source point of the kidney, Yuan source point of the liver, and the wood point of the spleen.
From the classical 69th.
Yeah. No, it doesn't apply. This is not the 69th chapter. Using the essence or the energetic quality of the points. So I'm using the Yuan source points because I'm wanting, thank you, Naomi, I'm wanting to tonify both the yin and the yang simultaneously. But by using the Yuan source points, we have more of an influence or more stimulation going towards promoting the yang qi. So if I was to use the water points, which I did use last treatment for Vivian, excuse me, but I'm not happy with the outcome. I mean, obviously she's got a migraine headache this week. For mine, best outcome if she goes a month or two without migraine headaches. There's a lot of situations, everyone's under a bit of pressure with the Rona bouncing around the place and different lifestyles, having partners in their presence all the time, the kids being home all the time. And there's a whole lot of factors that contrive to create a migraine headache in a liver deficiency constitution person like Vivian. But in this instance, I chose the Yuan source points because they directly build both the Jin-Ye and the Qi, but they have more of an influence over the Yang Qi and more of a stimulating factor and build the nutritive Qi as well. So it's a way of, because they are a source point and they are the earth point on the yin meridians, they are very power packed. And this is where we can use the understanding of the classics and actually applying the root treatment and being able to move our treatments around in a coordinated and cohesive fashion using the rationale that was first discovered and explored and then extrapolated in 2000 BC. And there is no question in my mind, after working in clinic with this particular approach, it's incredibly potent. And it does link it together so we get a treatment, a diagnosis that's aligned with the treatment, and we can then give a more accurate prognosis to the patient as well. And we also know that, hey, this didn't work. We have a logical manner to move around and explore why it didn't work, and then understand that, and then try a slightly different approach, but still aligned in the classics. So all the way we have like an interconnecting paradigm where we know what we're doing. We're following a path that was created 2,000 years ago. We're not trying to marry traditional East Asian medicine with Western medicine so that we're using points for headaches. No, we're using points to treat a liver deficiency constitution person who's developed a headache. In actual fact, we're actually using traditional East Asian medicine in our diagnosis. So again, just to explain, it's not, oh, you've got a migraine headache, I'm going to treat migraine headache. Oh, you have a migraine headache, why? You have stomach ulcers, why? And then not to look up the book, treat stomach ulcers this way, treat migraine headaches this way, but to understand from a traditional East Asian medical perspective what the heck is going on in the meridians, in the zang, in the fu, the interaction between the zang and the fu, between the zang and the zang, between the fu and the zang, between the zang fu and the meridians, between the meridians and the meridians. If we can comprehend the patient from that perspective, then it unleashes, in my experience, the full or a full of potency, a full of power of traditional East Asian medicine. And one of the problems we're going to experience and are already experiencing in the 21st century is a lot of the research data is based on people that are doing treatments that perhaps in some instances, they're not utilizing a classical system. They are treating migraine headaches by using whatever points, and you're sticking the needles in and walking away. This, again, is not the most effective, in my opinion, is not the most effective way to apply traditional acupuncture. So we're getting some very interesting outcomes and very interesting research data based on very basic skill levels of the people that are conducting the research. No criticism, just a fact.
Yeah.
Good.
Okay, so Linda is asking if you make distinctions from sign of the bodies on gender. I guess maybe from taking the pulse. I'm not sure what is the real question. In gender, do you make distinctions?
Definitely. Yeah, absolutely, 100%. As a result of the fact that a woman has an extra organ, the uterus, and that the uterus is totally blood orientated and intrinsically linked to the liver, which is intrinsically linked to the kidney, which is linked to everything. But yes, so how we treat women or a woman, women sounds weird, doesn't a woman, is very much relative to where they are in their cycle. whether they're actually bleeding or whether it's post menstruation, pre-menstruation. So yes, it's very, very important to distinguish between the in the segment of the menstrual cycle.
She was actually asking if you make a difference, if it's a male or female, to treat on a different side of the body or checking the pulse. No. Okay.
Sorry, I misinterpreted the question, but no.
Problem.
Bilateral points, no unilateral points, unless there's a very specific reason. The master and couple points, 8 extras, they are there and they can be utilised, but thank you. We're not dealing with that one at the moment.
Catherine Cato, she's asking if you could explain why gallbladder 41 and not gallbladder 40. Thank you.
Gallbladder 41, certainly in my case, I find far more effective in the treatment of migraine headaches. Gallbladder 40, I will use it primarily if I'm looking to move the yang qi to the extremities of the body. So I'd use it with a liver yin deficiency root treatment where the person is exhausted and very tired, but still yin deficient. In some instances, Catherine, I'll use the gallbladder 40 in conjunction with a spleen deficiency root treatment. Yeah, but again, when the forelimbs are very heavy and very tired, just to move the yang qi out to the extremities. Being that the Shaoyin meridian is primarily responsible for that, especially in the lower limbs. Thank you for your question.
Thank you, Alan. We have here another question from Yunko Yoshida. She's saying for liver yin and yang deficiency, needles amount is not too much. How do you judge how many needles the client can take?
Very good question, Yunko. The stronger the person is, so if they're yin deficient, so invariably the yin deficient person has more strength, there's more structure in the blood, there's more jin yang, so they have more endurance. So in that case, it's easier to use more points. The yang deficient patient would tend to use less points, needle more superficially, and leave the needles in for a shorter period of time, which reminds me, in just a moment, I'm going to have to go and take the needles out. I don't want to overcook my patient, of course, but less is more. That's the main thing. I did mention in an earlier workshop trying to help someone back in the days of my TCM days, a lovely aged lady who was 80 odd years of age, and I thought the more needles I put in, the better. And she had terrible sciatica, and I must put in 60 odd needles. I put in needles in every half sawn all the way down the bladder meridian. I laugh about it now, but I wasn't laughing about it then because her condition got worse and she never improved. That was definitely overkill, and I had no idea what I was doing. I just thought I was helping by putting more needles in, and she was yang deficient. So it was a classic case of asking a small battery to respond like a big battery, and all I did was flatten the battery, and her condition just went from bad to terrible. And yeah, I learned from it. That's the only plus. No other pluses available than that. And as Ikeda Sensei so poignantly said to me in 1998, that if I get too hung up on the mistakes that I made, then I will erode the quality of the treatments I'm providing other patients in that day. So I've learned to be able to move from one patient to the other without carrying, if you like, the guilt, knowing that I'm human and I'm certainly capable and available to make mistakes in treatment. But the most important factor is to have some way of assessing what the mistake was. If we don't have that, we're in quicksand. And over a period of time, it can be very erosive of our confidence as a practitioner.
Yes, I want to encourage the movement of yang qi from the head down. So we know that the bladder meridian and the gallbladder meridian start at the head and go down. So I'm just going to open up the suboccipit area. You'll notice invariably in migraine patient, this area will be blocked. There will be congestion here. So we're looking to Open up that area. This is where the one-handed needling is so important. We get a rhythm and we're able to apply the treatment with the minimum amount of fuss and the maximum amount of efficacy. Very important. And this is the very first skill that they teach in acupuncture school in Japan. So there's a lot of people try and get away without learning this. Well, fine. That's like building a house without a foundation. You will get into trouble at some stage and you'll never actually be able to exact the maximum efficacy out of your treatments. So there we go. I've just cleaned that area a little bit out. You'll notice I didn't do any heavy duty dispersion and all that. It was just to clear the area a little bit more. Now we're looking to, you'll see this is contact needling. I'm actually rotating the fingers, the thumb and forefinger, and rotating the needle with the right hand. As I contact, you'll see, and click, 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 if you like. So again, for those of you that have gone to the hardcore TCM school, it may be very difficult to believe that this does anything. I can only assure you that for me, it certainly does. And for Masakazu Ika Sensei, Edward Obeji Sensei, Naomi, Maria, Owen, many of the students that I've taught, many that have studied with Ikeda Sensei and Edward Obeji Sensei, we know that this actually works. How does it work? Because the defensive key is really superficial. So this hand, we're moving the key. We're bringing the yang key back down, down, yeah. And then immediately we cover with Vibhuti. So we don't want to leak any yang key out. Then we just come down from bladder 39 down the bladder meridian. And likewise down here, we just encourage the circulation down to bladder 58. Yeah, again, just, it's very beautiful. And the patient, Vivian, that feels nice when I do that. Yeah, it's a reassuring way to finish a treatment. So that is the treatment.
So we just have here a question from Sylvia. So Sylvia says, you can Sunim Jiao to strengthen the kidneys and large intestine 11 to strengthen the liver. By doing that, should we still tonify gallbladder 41? Why not shunt gallbladder 41?
Gallbladder 41, if the patient's suffering from migraines and they're a yin deficient constitution, a liver yin deficient constitution where there is an excessive amount of yang qi in the gallbladder meridian, then I would shunt gallbladder 41. But because there is not enough of yang qi, not enough yang qi in the gallbladder meridian, I need to build it up to get it to move down, not shunt it. So there's insufficient. If we shunt, we're actually, the shunting's mainly, we would use it when there is too much. Here, there's too much here, but there's not enough here. So by tonifying the gallbladder 41, we invigorate the movement of the yang qi down the meridian.
I don't know if you would like to talk about this. Some people asked here why, actually Raf asked, you use your hand to close the point and not a cotton bud. Would you explain why you do that in that way?
There's no blood. The needle's gone in 1 millimeter. I mean, my hands, I wash my hands between every patient. For mine, there's absolutely no problem whatsoever. Closing the point with the fingers is actually much more effective. And it's more reassuring to the patient that I wash my hands, got up to 50 times a day. And unless there's bleeding, I see no reason why you would use a cotton bud to close the point, none at all. So we're using a 0.14 gauge needle. The fact that I've been washing my hands so regularly throughout the day, and it's much more efficacious.
I'm just sharing here screens with you. I will just quickly show you the website. So if you don't know, this is World Acupuncture website. I encourage you to come and have a look. you can come here to the free videos, and you have here, you already have webinar 1 uploaded into the website that you can watch, but you have here a group of videos we selected from the more than 200 video lessons we have inside the website. So you can come here and have a look. Here in the, you can have an idea also of the different subscription we have. So we have annual, quarterly, and monthly. And we also have a shop where you can get the books that I've told you about. Also, you can have the Wisdom of the Classics, the video with Masakazu Ikeda. We have different books translated into English. And you can also have a forum where, well, I cannot go there now, but anyway, so you know there is a forum, you can have questions, and you can make your questions and any clinical situation that you want to discuss with Alan and with the group.
In my opinion, the most beautiful medicine, and it's so precious. After 37 years, I just love it. I love coming in, I love working with it, I love the fact that I can always grow with it, and I love the lineage. It's just so precious to be able to go back to these books and understand the classics and use the classical information in clinic. It certainly has reinforced my connection. And I now, as I said some webinars ago, I now feel part of the lineage, not some big guide and looking at something that other people are doing. And because they're Asian, now I'm actually part of the lineage. And so are you. We all are. It's just about how much we want to recognize the validity and the efficacy of the traditional East Asian medical physiology, pathophysiology, and philosophy, and the incredibly beautiful, refined techniques of traditional Japanese acupuncture. It is very special. 1 month's time, we're going to delve into constitutions so we can understand more about what we're looking for when we apply the treatment. Rather than just treating the disease state, we're treating the patient and looking to get them back to the most balanced state of health. So, yeah, from my heart, and with my heart, I wish you all the very best. Please stay safe, stay well.
Bye-bye.